Well, hello and welcome to the Swope Health Black History Series. We've got a whole month of series of speakers, and our first speaker is today we have with us Dr. Kimberly Beatty, who is the Chancellor of the Metropolitan Community College Association, colleges for Kansas City. And so we're so glad to have her with us today. I know you have a very busy schedule, and so just for people who are listening today, the way this format is going to work is that we're going to have a number of folks tuning in today. And so what we're going to do is allow Dr. Beatty to talk for about 15 to 20 minutes. And then we're going to do a question and answer piece. And you can feel free to put your questions in the chat. And then we'll just sort of go from there. This is a free-flowing conversation about the importance of the community college in our community and her historic appointment as the first African-American woman to serve as chancellor for the Metropolitan Community College. So welcome, Dr. Beatty.
Thank you, Duran, Mr. McGee. I appreciate the invitation, and I'm so grateful to Swope Health for taking this important stand on on Black History Month, during Black History Month, and inviting me to talk about the importance of the community college. And I look forward with engaging with the group a little later on. And not that you need to be corrected, but I think it's important to note that not the first African-American woman, but the first African-American period in the 105-year history of this institution. I think it says a lot about this institution and where it is, and the board and their direction that they wanted to take the college moving forward. So as you mentioned, I thought I would take the first part of this to talk about community colleges, what's important to me, and then I look forward to chatting with you. So I'm going to attempt to share my screen and put it in presentation mode. And I probably need to change the settings. Do you see 2 slides or 1?
1.
Oh, excellent. Okay. Well, first I thought I'd tell you a little bit about myself and my journey. I am not from Kansas City, but from a town very similar, I think, to Kansas City, and that's Pittsburgh. It's got a lot of the similar characteristics, Pittsburgh, Pennsylvania. I'm a 3-time graduate from Morgan State University, a historically Black college in Baltimore. And throughout my journey, very unintentionally, but I guess in a good way, have always broken stereotypes. I was raised by a single parent, came from very meager beginnings, and had all of the characteristics that say I shouldn't necessarily be in the seat that I am in, but I'm one of many who have broken those stereotypes all through my career. I've always been, again, I guess it's a good thing, but ironically, I've always been the first. Prior to this position, I was the first African-American to be the chief academic officer at Houston Community College, and then the first at Tidewater Community College. So, you know, it's a good thing, and that's an article and a book in itself, being the first. I'm gonna have to make a note of that. I've been doing this higher education thing for 33 years. I've not done anything else. I started out teaching adjunct and taught in the university setting and community colleges. Found when I moved to California, fell in love with the community college system because there's so many of them out there, and have been doing it ever since. The reason why I've chosen community colleges as my path is because it aligns with those things that are passionate to me. And I'm going to talk a little bit more about that. And that is access, equity, and the underserved. I know I embody all of these characteristics in terms of having, getting the access, equity, and being one of the underserved that has come through the ranks and had a great journey. And so that's what I make my passion. Many of us who are in this sector could be at a 4-year university, could be doing a lot of other things. But when you want to change lives, you come and work at the community college. So that's leads nicely into what the value of community colleges are, and how they emerge. So community colleges, they are directly tied to history. They flourished during the 1960s. And if you think about what was happening in the 1960s, it was huge, segregation was huge. And while Metropolitan Community College has been around, and there's some colleges that have been around a long time, these community colleges really flourished during that time. They were designed to democratize higher education. Prior to the prior to community colleges, if you didn't go to a historically Black college, you really didn't see a true path for yourself in higher education. So it created that opportunity and that path. And then the initial focus then therefore was on access, because they wanted an on-ramp for people to have access. The American Association of Community Colleges, of which I'm a board member, is our national association. We have, and this gives you kind of the fast facts of community colleges. We have 1,044 public community colleges. I'm sorry, 1,044 community colleges, and 936 of those are public, 35 are tribal, and 73 are independent. And the difference is just how those colleges are governed and funded. We have offered 900,000 associate degrees. We offer certificates where you can get trained in a specific field and get a certificate and go to work. And then there are many institutions, and the MCC is one of them, that offer baccalaureate degrees. We just recently were approved for a bachelor's degree in respiratory therapy, and we'll be offering that beginning in 2023. But as of fall 2019, you can see the headcount and enrollment total across the country, 6.8 million. And I can tell you in Missouri, we educate 46% of the Missourians. Mr. McGee will know when he was in the legislative seat, we used to come and say, we educate 46% of Missourians and we get 13% of the higher education budget, but still we thrive and still we survive. We also offer a lot of non-credit courses like photography, or even some training courses that aren't necessarily a part of a degree, but are focused on a specific skill set. So you can see those national data points. MCC specifically is very aligned with these national in terms of women and men where gender is concerned. And you see the demographics. These are the national demographics for community colleges. So community colleges touch a lot of lives in the United States. When we look at the evolution of community colleges, as I mentioned, they were began in the 1960s. And primarily, again, tying it to history, designed to have the assurance that women and people of color had access to higher education. Then I would say around the 1980s, and this is Kim Beatty's timeline. This is not I started in the 80s, and this is kind of my timeline, my perception of the evolution of community colleges as I've seen things shift. Then we moved into, well, we can get them in. And this was really a national movement in the 80s because affirmative action was huge. They were coming and they were saying, hey, we need to diversify our population. I remember I had a cousin that was recruited to Penn State, and they were lowering standards because they wanted to get people in the door, even at the four-year colleges, but there was nothing in place to help them to be successful. So in community colleges during the 1980s, it moved to a mission of access and success, where there was a focus on providing those resources to not only get you in the door, but keep you in the door so that you would be able to now moving to the next phase of completion. Around the now we've always wanted people to be successful. We've always wanted to complete. This timeline focuses on where the intentionality around these efforts really began. And so in the 1990s and 2000, early 2000s, we started to focus to getting students through and placed and either transfer an institute, because you can come and you can be successful. And a lot of people were using that word success and this big broad umbrella, but you can have success and never complete. If I was in church, that'd have been an amen moment right there. But you can have success and never complete. And so what we were seeing is a lot of people weren't finishing college. And so we wanted to really be intentional about how we can get people through. And then lastly, where we are, I'd say 2015 to present, there began a focus on equity. And now we're looking at, well, we get them through, but we don't get them through at the same rate at other groups. And why is that? And how can we have an impact on that? So that's why you see a lot of men of color organizations or support programs in community colleges or in colleges on a whole. When I was in California as a faculty member, I created a Black Studies learning community, a Black Studies program that became a statewide model so that people could talk about and research topics focused on who they are. So that's kind of how it has evolved. And I would say we're right there with that equity focus. So in addressing the imperative, I early on was very interested in this, as I shared with my early passion for getting into this work. And so earlier this year, for the last 4 years, I've been working on a book and was published this year that focused on becoming an equity-centered institution. Because the imperative that we have now with community colleges is that we have the persistence disparities. In other words, we have those people who fit, we have groups we know, either first generation, low income, Black students that don't persist and finish at the same rate as others. We know from, in looking at our own data, for example, at MCC, we know that students will persist from semester to semester, but then getting all the way out the door, something happens there. And that's not just at MCC. There are several institutions where I've served, and that's been the case. Employee and student satisfaction is also part of the imperative. We have employees, every institution I've worked at, and MCC is no exception, that are dissatisfied, and sometimes there are these equity issues that keep them from staying at an institution. Same thing with students and how they're treated or perceived as they walk in the door. We have a lack of leadership skills in some cases, or not the right leadership skills in the right place. There's changing accountability requirements. We serve community colleges and universities have to adhere to accountability agencies for accreditation. Higher Learning Commission is our accrediting body. And there are some requirements that they have in there that make this make it an imperative. And then there are the obvious social and historical issues in our country that are happening right now with Black people being murdered and by police, and the inequitable treatment that's happening that kind of trickles down unintentionally or intentionally in some cases into the lens of people who may be serving in their roles. So what we did in this text is create a roadmap, a guide for how you can address these imperatives and become an equity-centered institution. I always use this word, the linchpin. In my view, community colleges are the linchpin for the African American community, especially because they contribute to the economic health of the community. Not only, first, we contribute to the economic health of the community because of the jobs that we provide. Metropolitan Community College, as an example, employs over 2,000 people, full-time and part-time. Full-time, about 850 people. That's a lot of jobs. In fact, we're one of the larger employers in this region. In addition to the jobs that we provide, the programs obviously that we create, the people who go through them and then they stay here will contribute to the economic health. And then as there's some projects that we have just finished as an example, where we make an investment over on Truce at 2940 Truce. We have made a $36 million investment in a new advanced technical skills training institute so that folks on the bus line have the access to come and get trained, which leads to the next linchpin is that we close the skill gap. There's the opportunity to close the skill gap. We want people to come, and if you're hearing my voice, we're hoping that you'll come and get registered so that we can help you determine what that skill is and how you can develop it, the best program for you so that you can move into either of these next two bullets, which is we are a transfer institution. We have amazing liberal arts programs, and this is not a commercial for MCC. It's just the fact of all of the community colleges in the country. This is what we do. But I can make it a commercial about MCC because I'm so passionate about what we do. And most people don't realize, but all of our programs, we place and prepare people for jobs. Our placement rate is above 90% in all of our skilled trade programs, and we have amazing programs. And again, MCC is maybe unique in over 90% placement rate in all the programs, but we are not unique in this being the linchpin of what community colleges do and what they do, especially for the Black community. But I'd say they've got to come to it. We've taken the horse to water, especially in this community. Now we need to have them come and drink. If you have any questions about how we can help you to become more engaged with MCC, or if you have other questions that you want to talk to me about, I'd be glad to address them with you. That's all I've got.
Well, thank you, Dr. Beatty. I appreciate the presentation that you provided. I do want to follow up on some of the things you said, but before we get started with some follow-up questions, again, if you have any questions, feel free to put them in the chat. We're going to have this conversation, explore further this discussion with Dr. Beatty and this conversation here today. And we're just so grateful to have her here with us and taking this hour in our first part of our Lunch and Learn series with Swope Health Black History series. So a couple things that you said that I wanted to follow up on, Dr. Beatty. You talked a little bit about the disparities that you saw early on in your career. And can you talk somewhat about the disparity amongst the teaching staff? I mean, how many folks look like us in these classrooms, right? And so that's important because I assume early on in your career, there was someone that saw something in you that mentored you to put you on a path that you have now taken, right? And so in terms of the faculty and staff, what are you doing? What is MCC doing to help close that disparity amongst the faculty and staff that are touching these African-American students that enroll in these programs? You know, so what's happening with that with MCC and in the greater community college plan as a whole?
Well, at Metropolitan Community College, that's an area where we need to do some work. We've got nearly 30% of our students are students of color, and our faculty numbers do not align with that. So there is a gap there. What we are doing is, what I'm doing is what I can do. What I can do is take a close look at our policies and how we are conducting searches. And so as early as this morning, as late or as recent as this morning, I just had a conversation with our HR director about what we call a diversity advocate in terms of our search and what our searches and what that process is. You know, there's a big weight that has always been on me as a Black leader. And I remember at Houston, many of the Black folks when I was working there came and said, "Oh, you're our great Black hope." And because you're the black face, or the, I shouldn't say black face, but because I am black and the face of the college, there's this assumption that, oh, you can just make it happen. Well, what I have control over, I mean, I have control ultimately over everything, but where I have the best control is with our policy and how we do our searches, how we advertise and where we advertise our searches, and making sure that our committees are diverse, making sure that our committees are trained, and having that codified in policy. So we just recently revised our procedures for hiring, and we're putting those into place and moving, trying to make strides and making that happen.
And Dr. Beatty, one of the things you also mentioned, you were talking about this idea, I know you've been really big on this in your tenure there, is workforce development. Mm-hmm. Can you talk, from our perspective as a health center, can you talk about the importance really now of workforce development in the age of COVID? Because as you know, there are shortages in the workforce all across various sectors, particularly in healthcare, but across various fields. Can you talk about the role of the community college with regard to workforce, but particularly in the field in this age of COVID?
Well, it hasn't, and from our perspective, it hasn't changed. Because the workforce, as you mentioned, since I came, I've been talking about the workforce development need. When I arrived in Kansas City, one of the first things that I realized is that Metropolitan Community College, as somebody in the community, in the business community told me, was not, quote, top of mind. And that is, we were not seen as and we're building this momentum to be seen as the go-to for skilled training and workforce training. So, but that's a double-edged sword. The double-edged sword of that is partnering with the business community to find out exactly what is it that's needed, and ensuring that those programs are offered. And pleasantly surprised as I was, is we had a lot of the programs, but they weren't accessible in a way where people could get to them. I mean, all of the programs that we moved over to Truce, over to Blue River and Independence, and here the engineering technology building at Penn Valley, were all on Front Street in a business park where a bus comes through there once a day. And so the average person to get there was of a certain gender and demographic. Let me just put it that way. So my commitment to workforce is demonstrated by the results of making sure that we put that in the urban core where people have access to it, ensuring that those programs are aligned with what we need, the industries that are in high need, high demand. And they've always been in manufacturing, automotive have always been in high need, high demand here. And as you mentioned, healthcare as well. Our most recent, I mentioned it in my presentation, that when Dr. Lee, who's president at the Penn Valley campus, when we both arrived at the same time, and we were surprised at our Health Sciences Institute that every health program that you can imagine is there, occupational therapy, nursing, and all these great programs that are there. But respiratory care was not there. And surprisingly, it is not offered in this community. Pre-COVID, we had the vision of that being a workforce need and a gap in this community. And so now I'm really pleased that we'll be developing that program, and not at the associate's level, at the baccalaureate level.
One of the things I know, working in the community college, you see the direct product of the high school educational system of the city, right? And so you sort of see where the things are lacking in terms of the skill set that the high school educational system is producing. What are some of the things that you are seeing in terms of the students that you bring into the community college in terms of skill sets that are lacking, that students aren't getting from the high schools? Because I know you guys see this firsthand.
Well, historically, we could always do the pointing downstream. We can say, oh, they didn't get this in high school. And then the high schools might say, oh, well, we didn't get this. They didn't, the parents aren't doing X, Y, Z. So I don't know that it's a pointing of fingers to what they didn't get in high school. I just think, I think society and our values are changing in a way that are impacting the students that we get. For example, students now want to get stuff quick. They, you know, and that's a societal thing. They want it quick. They don't necessarily understand the value of work and hard work. Well, I came every day, I should pass the class. No, no, that doesn't mean that you pass the class just because you showed up every day. So, I mean, you'd be surprised how many people feel that way. Now, that may be something, I wouldn't want to point fingers or say this for sure, but that may be something that is acculturated in a high school environment. But also what we're noticing is a high need, a much higher need of mental health that are coming through. And I don't think that's anybody, but it's a disruption into how people can be successful. And there's also there's so much of this that was even happening before COVID because people were always on their games, that we've had to keep pace with how to identify the best ways of learning, which was the best thing with COVID. Because I mean, we've wanted to offer virtual classes for a long time, but it was hard to move people in that direction. And now we had to. So that helps, but it also creates a situation where many of our students may struggle a little bit more with the social skills that are necessary. When what I hear from employers, because they will say, when you go to the employer, they'll point down and say they didn't get this in college, is I was just with at a conference where they talked about onboarding people into work, because people that are going right through college, as I did, when they come to work, they are not acculturated or acclimated to what it takes to, what it means to be on time and what it means to, you know, put in the work. So those, it's really the soft skills that I've seen a decline of over probably the last 15 years. And like I said, I think that's more of a societal thing.
Right.
And maybe how people are, I mean, you know, you and I might be, well, maybe not, but I know in my generation, how I was raised, there's some things I see people doing and I'm saying, man, now that would not have flied, if that would not fly in my mama's house. But people get away with it. And so they bring all that when they come to college.
Now, I know one of the challenges we talked about was finding, you know, faculty of color. Is part of the issue also the pay of faculty in the community college system?
I don't know that it's unique to the community college system, because I've checked what they pay at UMKC and you know, so forth. This is not a glorified role. I mean, if you're going to get into education, you're not getting into it for the money. So yes, it is the pay, and it's the pay, especially in the trades, where if I'm a welder and I can go out on a job, I'm going to make much more money than I'm going to make pay, you know, by course anywhere. So it is, and that's another aspect of how our society, you know, has changed. I mean, we have, part of what we're experiencing now that everybody's experiencing is that great resignation, but also that people, what they expect out of their work, or, you know, what they should be afforded, the privileges that they should be afforded in a job. And that's not what we do in a community college. You have to be here to serve students, because everybody doesn't have, what we did learn through COVID is a digital divide, and that the lack of equity where that is concerned. And so we can't just have people working from home, and people are leaving because there are jobs out there that'll pay more and give you that luxury of working from home. I'm not mad at you. That's just not what we do.
Well, if you are still joining us here to listen to our conversation with Dr. Beatty, We are still taking questions in the chat. We're going to take a few questions from the chat, Dr. Beatty. One of the questions here, and I think this is a good one. What is, as a Black woman who is chancellor of a major community college, what is the greatest challenge you've experienced so far in your tenure as chancellor at MCC?
You know, it's kind of what all of us probably experience, maybe just at a higher scale. It's some of the, didn't I just say that if I'm in a meeting and somebody else says something, but it comes from somebody who doesn't look like us, and it's like, oh, yeah, and they all jump on it. And I'm like, I don't let people get away with that, by the way. I'll say, yes, as I was saying, or something like that. What I also would deal with that I don't think it's just at a larger scale and perhaps more often, and I don't think it's uncommon with any Black leader in any industry, is now, would you really say that or do that if I was a white man? You know, there's a lot of things that come. So that's a challenge that I'm constantly having to, you know, and part of that might be me bringing that on myself, but I believe my husband always says, you start the way you want to finish. And so I believe in starting the way I want to finish, and sometimes I have to let people know. And so those are some of the things. I in your previous role and that arena and interacting there, I had a really good wake-up call in that arena. I don't think people appreciate women who know what they know and are firm in their position. And then you Black on top of that, it can be problematic for people who have titles and roles and don't have the, so I do experience that.
Well, it's actually funny you mentioned that, because there's a follow-up question to that someone put in the chat. How do you differentiate and deal with the challenge of not only racism as a Black woman, but also sexism as a woman? So
Yeah.
it's almost like a double whammy.
It is a double whammy. You don't know which one you get whammed with at the time it's whammed. You getting whammed. It is. And you know what I try to focus on is it bothered me last year when I was it was in my face. I mean, this was the one time that I had something happen where it was really in my face. But I just focus on doing the best job that I can do. And when people go low, I go high, as my girl back there says. When they go low, I go high, and I just focus on what I'm supposed to be doing. And if I make a mistake, I own it. But it is interesting. It's a double whammy, but it takes the right person and personality. You have to be confident, but not cocky. You have to lead with grace. And sometimes I fail at that, because when it happens, I kind of have to, you know, think through some things, but it does happen.
So another question we've got, Dr. Beatty, is how do you place students at the enroll in MCC? How do you place those students, and do you have a placement office?
Yes, career services. And so many of our career and technical programs, when we talk about placing them in jobs, they are exam oriented at the end of those programs, and based upon their completion of that program and that exam, then we have job fairs, and we have a career services office where we host and connect students with employers. So our police and fire academy, we have a public safety institute, and our police and fire academy, they have relationships, long-standing relationships with employers, with those agencies that are, you know, just chomping at the bits. So we have a long history of our relationships. We're developing relationships, and we create forums for our students to get connected.
And do you have an information technology as a field of study at MCC?
Yes.
Okay.
Yes.
Another,
we have over 100 programs, and
okay.
so sometimes it takes me a little bit of time to reflect on whether or not we do.
Another question in the chat, Dr. Beatty, is would you consider exploring the possibility of establishing a doula or midwife training program to address the disparities of African American women and the infant mortality rates?
I think that's worth a conversation. So that person can send me an email. We have a Health Sciences Institute. There might be the possibility of a certificate to develop there. We have to look at, we do an analysis of the need, but I like the connection to the high rates of infant mortality in the Black community as a data point to support that. So I think that's definitely something that we consider. I'm fairly certain we don't have that now. There might be a class within our OB, within our nursing program that addresses it, but I'm certain that we don't have a specific certificate in that now.
Another question from the chat, Dr. Beatty, is that Kansas City's charitable nonprofit sector accounts for 11.5% of Kansas City's gross metropolitan product in 2018. Are there programs available to train workers in the nonprofit program development or management sector at MCC?
Well, I would say the management, we have business and business management as a degree, and I think that transfers well in terms of transferable skills and transferable knowledge. I think that transfers well in that arena.
Okay. So Dr. Beatty, so if you had a crystal ball, what would you say is the future of community colleges and specifically the future of MCC over the next 10 years?
Well, that is a loaded question. Where should I begin? I'm going to start nationally with the state and then locally.
Okay.
So nationally, we have a perception challenge with community colleges. People consider it the 13th grade. They consider it just for people who are getting out of high school, or they consider it just for as a vo-tech, the old language of the vo-tech. So that's something that a perception that we've been battling. No matter where you go, that's a perception that you're battling. In this state, that's coupled or compounded with an appreciation through how we're funded. We have 3 funding sources: tuition, local taxes, and our state. And normally those funding models in the historic history of community colleges was intended to be a third, a third, a third. And that doesn't always exist. And in fact, you've got some states where they're state located, they're not even state funded. In Missouri, we have such an impact in terms of, and that number, in terms of educating 46% of Missourians and getting, it's either 13 or 15% of the higher education budget. Well, I can tell you 10 years ago, our budget from the state was, our allocation from the state was 32 million, and now it's 30 million. So inflation has gone up, but our allocation has gone down. Programs are more and more expensive. I mean, the machining programs, manufacturing programs, nursing, automotive, these buildings that we're putting up to support the industry, those are expensive. And I believe the intention of our current governor in terms of investing in workforce, and that's happening through one-time dollars, and we appreciate that. That helps us to get these programs developed. But we also, you alluded to it, we have to attract good talent. We have to retain good talent. And so if that core stays the same and stays stagnant, and everybody else and every other organization is going up, somehow we have to make those adjustments. And then locally, I think we've done a good job over the last 5 years, not just myself, but I've worked with 4 great presidents, and they all have leadership teams that have been out in the community to spread the good news about MCC that I don't believe has been spread in that way in the past. And we're all out building relationships. And so I think there's a renewed sense of the value proposition of what Metropolitan Community College can do specifically in this community. We still have those other factors. And I will say that this community has been extremely good to Metropolitan Community College. We're in the midst of a campaign, and we've already raised quite a bit of money from foundation. I mean, it's a very philanthropic city. And I think our team, our street team, being out there sharing the information, making people more aware so MCC can be top of mind, has helped us to build a reputation in this community that's valuable. But we still have a lot of work to do in the state, and we still have a lot of work to do nationally. And we're on the come up in the city in terms of how they view our college. So I say all that to say that the outlook in the future of MCC and my crystal ball is bright. When I came here, I had a vision, and I'm real pleased to say I was getting chills as I went through and toured the Advanced Technical Skills Institute last, I think day before yesterday, when I went through there to see the vision come to fruition, because I knew we needed to have a central hub in the urban core for our community, and it has come to fruition. So we just need our community to show up.
Well, you know, it's interesting you talk about the history of the community college in the city, and I didn't know until, you know, a couple of years ago that the original building for the original community college was the old Westport High School.
Yep.
And now it is Plex Pod, that many people know it as Plex Pod today, but that was the original building for the first community college in the city. So we had one more question here in the chat, and we'll be wrapping things up, is you spoke about being in the position of the first of many in your roles throughout your career. What advice would you give young Black women leaders that follow you and others in your footsteps?
Okay, there's a couple of things. One, stay true to yourself, and not to sacrifice your values to get where you want to be. Hone your craft. You never want, you know, I'd be lying if there weren't opportunities that I had that I didn't question. Well, did I get this opportunity, or was I presented with this opportunity because I'm Black? And sometimes I know that and I leverage it. But don't allow that. don't allow that to you know, squash what you. If you hone your craft, then nobody can question why you're here. And then the other thing is to find mentors, internal and external, to what you do. It's great to have internal. So for example, I might have mentors in my sector, but I also have mentors outside of my sector who can give me a perspective that somebody within the sector wouldn't, in terms of how I might be perceived, or, you know, some of those soft skills, or how I might need to hone my craft or to reach a certain group. So mentorship, honing your craft, stay true to yourself and your values are some of the anchors that I live by, because I think your integrity is all you have, and you need to be good at what you do. And the folks who work with me know that I rarely, if ever, will ask them to do something that I'm not prepared to do myself or haven't done already, because it's important that people know that you are, you have the experience to be where you are.
Well, Dr. Bay, I got one last question for you. So this is a fun one. You know, go back to your 16-year-old self. What was the job that you most wanted to do?
I wanted to be the first Black Barbara Walters. I wanted to be on the news. And Barbara Walters, to me, she had this knack of being able to speak without really opening her mouth real wide, if you ever pay attention to her. Anyway, I grew up watching her, and I wanted to go into communications, and stuck with that, went to Morgan with that major, until my freshman orientation class. Miss Dobson, I just recently told this story. Miss Dobson and my freshman orientation class had us do some type of assignment. And she said, I want to connect you. She said, have you ever thought of being a lawyer? And I said, no, never. I want to go into communications. She said, well, I want to connect you with the Black judge in in Baltimore. And I went and sat in his court. He went to Morgan and told his story about how he flunked out and so forth. And then he inspired me so that I said, well, I want to go to law school. And I changed my major to English. And that's how I ended up on my path. But I blew the LSAT. So I went to graduate school, not by choice, but I went to quite by accident and started teaching in grad school. So that's how I ended up getting here.
Well, Dr. Beatty, I want to first thank you for being with us today over this lunch hour. And I really appreciate you giving your story and giving us insight into the community college and just the great work that you're doing. And on behalf of Swope Health, we just want to thank you for all the great work that you're doing and being with us today. And I know that, this isn't an interview Barbara Walters worthy, but I am grateful that you are here with me today and with our attendees here today. And so I just really am so grateful that you took the time to be with us today in the first of our series of speakers for the whole month of February. So thank you so much. And any last comments that you want to give?
Well, I just appreciate you thinking of me. I'm honored to serve. I do this because I'm passionate about it. And anytime I can step in and share information, I'm very glad to do it. So thank you. And thanks to Swope Health for all you do in our community.
And for all of those listening here today, this will be available. It's recorded and we will send this out as well via email. So if you missed it or somebody else wanted to join in and was not able to join us today, we will get this out and you can forward this along or someone else can tune in and watch at their leisure. So thank you so much, Dr. Beatty, and thank you for the great work you're doing. Thank you all for joining in.
Thank you.